Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to talk about Blake Lively. She is now 34 years old, and she is well known for starring in Gossip Girl in her 20s, so pretty young. And the reason we're talking about her today is she's also known as kind of an icon for beauty now, or natural beauty. So I think we wanted to take a look at what surgery she has done and how she maintained that natural beauty. So one of the reasons I'm talking about Blake is lots of my patients that come in wanting a conservative rhinoplasty bring in the transformation photos of Blake Lively, and they say, I would like to have this type of transformation. I want to look like a better version of myself. I don't want it overdone. I want to maintain this kind of natural, beautiful looking nose I could have been born with. So I get a lot of that, so I thought we would go through that rhinoplasty, or alleged rhinoplasty. And if the rhinoplasty did happen, it probably happened right before she got onto Gossip Girl. Most people are speculating around 2006, 2007. And if we look at her nose, Blake before then did have a bulbous, kind of plunging nasal tip and a wider nose. And then we see her a little bit later and the nose is smaller, more defined. The bulbous plunging nasal tip is gone. So I think very suspicious for a rhinoplasty then, and done well, done conservatively, looks very natural. And I think that's why a lot of people pick up on that and like that kind of result. I think the other thing that's commented on was that she was kind of born with heavier upper eyelids, and we do see afterwards maybe a little more opening, and that heaviness of her eyelids is gone. So it's possible again for an upper blepharoplasty or upper eyelid kind of lift. And that's something typically done more for aging and heaviness of the eyes and a tired look. But some people are born that way. Some people hereditarily wise have heavy upper eyelids. And so they can do that surgery younger to open up the eyes and make them appear more rested and show their eyes more and bring them out. So I think it's suspicious probably for both of those things. But again, I think it was done very well. And I think that's why she's still kind of the icon for natural beauty. And then there's some more speculation about Blake that she may have undergone a second rhinoplasty sometime after that first one, maybe several years later, maybe more towards 2010. And I do want to comment on that because I do think it's very common for patients. And again, I think a smarter way to do it is to do a conservative rhinoplasty. And if you want to come back and do a little tweak and do a little bit more, it's better than overdoing it in the first place. And I do see it's very common for patients, particularly when they have very wide, bulbous, thick noses and they shrink it down, they may come back for a little tweak or finesse rhinoplasty to just define it a little bit more and shape it up just a little bit more. After that skin envelope of the nose is shrunk down, they want to come back and tweak it just a little bit. And I think that's fine. And I think in her case, we do see that the bridge of the nose and the tip of the nose did become a little bit more defined, and the bridge is narrower and the tip is just a little bit more defined. I do notice a slight bit of tip asymmetry still there, but again, it may be a little bit of swelling, and that'll improve over time. But I would say it is suspicious that she went and did a second kind of finesse rhinoplasty after that first one. Again, I think it's interesting that even though Blake's plastic surgery is somewhat recognizable, she isn't regarded as one of these fake or overdone celebrities. And I think that's because she didn't do it. She didn't overdo it. She didn't over-alter herself. She didn't make herself into somebody completely different. She's just a better version of herself. And I think there's a couple other things that I do notice that at some point she probably did do a breast augmentation. We noticed that her breast did get fuller, but again, respectfully, didn't go too big, didn't make it extremely noticeable, but it does look, the breasts do look a little bit fuller. And then secondly, probably a little bit of either Botox or fillers. We can see her lips are a little bit fuller. They were really thin when she was younger, and they're slightly fuller now. But again, not overdone. They're not overly obnoxious and getting in the way. They're just a little bit plumper and natural. And I think that's, again, the right way to do lip filler if you're going to do it. So why isn't there more conversation or buzz in the media about Blake Lively's transformation? And I think one of the reasons is because it was done tastefully. It was done naturally. In that case, it doesn't garner as much attention and criticism. Because when people overdo it, they immediately get all the attention, and along with that comes criticism. And I think Blake did it right because she has the financial means to do whatever she wants, but she kept it conservative. She did the right thing. She ended up looking like a person she's supposed to look like, herself, but just better. So I think that's, in this case, an example of what to do with plastic surgery. So like I always say, I personally think the best type of plastic surgery is imperceptible, and it doesn't give the patient's secret away. And in fact, if we didn't have all of these before pictures of Blake and you just met her now after the surgery, you wouldn't say, oh, she had a rhinoplasty, she had surgery done, because the nose looks natural. And I think that's some of the best type of plastic surgery. And I do think that the more recent trend of extreme plastic surgery sometimes may be more about getting attention than aesthetics and beauty. And I think that's the wrong reasons to do plastic surgery. I think good plastic surgery done for the right versions is just making yourself like Blake, a better version of yourself 2.0. So I think in the end, most patients, again, want to look like a better version of themselves and not somebody completely different.
Two of Blake's main co-stars on Gossip Girl, Taylor Momsen, I think is how you say her name, and Leighton Meester. I don't know, because I didn't watch Gossip Girl. But
neither did I.
They also, surprise. They also have had their noses done. Do you think that having a rhinoplasty is almost like a rite of passage in Hollywood?
No, I do think that the nose is one of the cornerstone features of the face, right? So it's one of the first things we're looking at in beauty and aesthetics. So yes, I think as far as attractiveness, being photogenic, looking good on camera, you know, it's one of those things that can be a distraction or it can add to your beauty. So I think a lot of people do want to tweak their noses to, you know, when they're in front of the camera, and if they see it, they're like, oh my God, my nose is so big, right away. So I think there is some of that, but I don't think everybody necessarily has to do their nose. And particularly in those cases we've discussed before, where it's adding character to the face, it can do them harm. You know, sometimes people's noses, you know, we don't have to always say them, right? But like Owen Wilson, those type of actors, it's their character, it's part of who they are and their persona, so they can't do it. Jennifer Grey, you know, from Dirty Dancing, I think, is that was her name? I think.
Yeah.
You know, actors like that have a characteristic hump or characters of their nose, they, you know, maybe it is interesting that, like in her case, if they do it before they become super famous, it works better than after they became super famous and then try to change it, because again, then people really notice, and it was part of their character, it could almost ruin them. So in her case, again, she did it right. She did it kind of before she really blew up so that they know her as that.